Hi, my name is Tammy. I work here at Southeastern Radiology Associates. I'm a mammography tech who's worked here approximately 35 years now. And I'm here to talk to you about what to expect when you're called back from a screening mammogram, or perhaps you had to schedule a diagnostic mammogram because you felt something, your provider felt something in your breast tissue, or you've seen a change in your breast tissue. So there's 3 reports that you may receive after having one of these 2 mammograms. First off, your screening mammogram, if you're called back for additional views, you may experience having a mammogram with a compressed area a little bit tighter than what you had for your regular mammogram to clear up an area of breast tissue that maybe is on top of other breast tissues, separating out so that the radiologist can say, this is normal breast tissue for you. It changes as we age. Everything looks good. We'll see you back in a year. The second report that you may receive is that this area may be a cyst. It may be benign, which is not cancerous, tumor or fibroadenoma. We're not really worried about the area. However, we need to do a 3 to 6 month follow-up just to check that there's no further changes in this. And then there's that third mammogram report that nobody wants to hear, and that's that we need to do a biopsy. I want to throw in here that 80% of all biopsies are negative. Try not to worry. Easy thing to say, not to do. If you get a report that you need to have a biopsy, it is not the end of the world. We're here for early detection. We want you to have your mammogram once a year. We would like for you to see your provider once a year, and we'd also like for you to do a breast self-examination once a month. Early detection is your best protection. So if you get that report that you have to have a biopsy, there's 2 methods that we do here in our office. There's an STB, which is stereotactic breast biopsy, and then there's also ultrasound. There's a little bit of differences between the 2 of these, but not much. One difference with ultrasound, you lay down on the table just like you did when you had your ultrasound of your breast. The other difference is the radiologist uses a handheld device. It takes approximately 2, 3, or 4 samples. So the other biopsy is the STB, the stereotactic breast biopsy. And that uses a biopsy system with a computer. You'll be asked to sit in a chair. The chair will come up to the unit here. You'll be placed in this mammogram unit, such as your mammogram, with the compression on it. The radiologist will numb the breast tissue. He'll also make a small paper cut incision, very tiny incision. The mammogram equipment, this one here is our vacuum system. We'll literally vacuum out very small samples so that the radiologist, while you're in this position, can take pictures with the Cub Tech and see that he's got the exact area out that he wants to send over to pathology. So while we have this area open, whether it's in ultrasound or in the mammogram position, we will use a metallic clip. This metallic clip is placed exactly where those samples came out of your breast tissue. There is no side effect to this clip. You'll never feel it. Afterwards, there'll be a small Band-Aid placed, and then we'll do a 2-view mammogram so that the radiologist can see that the clip is placed exactly where it needs to be and that the breast tissue looks fine. Now, when we make your appointment for your biopsy, we will also make an appointment with your provider for 3 to 5 days after your mammogram biopsy or your ultrasound biopsy so that they can give you your results, and they can also go over with you what needs to be done as your next course of action. So if you get a positive for breast cancer in your pathology report, your provider will get this pathology report as well, and they will refer you to a surgeon in a cancer center for future further treatment. We have Gibson Cancer Center in our community. We have wonderful surgeons at UNC as well. Having a family member myself that's had care and treatment from Gibson Cancer Center after breast cancer, I can safely say that you will be in great hands there for your care, your needs, and your treatment. They were absolutely wonderful.
Each year, we ceremoniously light a pink ribbon atop UNC Health Southeastern in observance of October as Breast Cancer Awareness Month. The ribbon remains lit throughout the month as a reminder for women to participate in screenings in the fight against breast cancer.